When you go to the dentist to get a root canal done or a wisdom tooth removed, the dentist usually sends you home with an antibiotic, a mouthwash, and a strong pain reliever. After a while, the anesthesia begins to wear off, so you decide to take one of the pain relievers. Immediately after, you start to feel really relaxed or even high. Medications that cause this effect are narcotics or opioids. An opioid is a compound containing opium and addictive properties. And because of these addictive properties, many seek these drugs and misuse them, and some even overdose. According to the Centers for Disease Control and Prevention website, maintained by the US government, updated on December the 19th of 2018, an average of 130 Americans died of opioid overdose every day. Today I'm going to discuss 1, the factors that cause the rise of opioid use, 2, what we can do to decrease these risks, and 3, how to identify and reverse opioid overdosing. Opioids have been around for hundreds of years, but in the 1990s, opioid use started to rise. One of the main causes for this rise was due to the false advertisement of pharmaceutical companies, which resulted in doctors believing that they were safe for their patients. Jan Hoffman, a writer of the New York Times, published on August the 26th of 2019 how an Oklahoma judge ruled against Johnson & Johnson for downplaying the dangers of opioids, making them responsible for paying $572 million to affected families. The second factor is the overprescribing of opioids by healthcare practitioners. Practitioners are prescribing opioids for acute pains that can be easily resolved by over-the-counter pain relievers, and some are even prescribing them upon patients' request. The third cause is that opioids are getting into the hands of people that do not need the medications and are abusing them. They're finding the drugs being sold illegally on the streets or even in your own homes. With the constant rise of opioid use, there are ways that one can decrease opioid addiction and overdose. One way that we can decrease this is by properly disposing of medications that are no longer being taken. The Food and Drug Administration, last updated on February 1st of 2019, stated that the best way to dispose of old, unused, unwanted, and expired medications is at a drug take-back site. There are kiosks available at certain pharmacies where you can just go and drop off your medications versus throwing them in the trash. This prevents others from finding and using your medications. The second way is to keep these medications in a safe and secure place where there's no easy access. A high, out-of-reach location is the best place to keep them stored. The third way is by keeping your vials child-proof versus using SnapCap. Child-proof is harder to remove and requires more strength. SnapCap, you can just twist that on and snap right off. Even with precautions in place, there is always a chance of an overdose. There are signs that can help you identify when someone is overdosing. The U.S. National Library of Medicine website, updated on September the 3rd of 2019, states that the signs of overdose include labored breathing, paleness of the skin, and unresponsiveness. Even those that have been taking opioids for years are still at risk. Fortunately, there is a reversal drug available at your pharmacy where you can just go and request without a prescription. The medication is called naloxone. Naloxone can restore normal respiration to those that have trouble breathing because of an opioid overdose. According to the U.S. National Institute of Drug Abuse website, maintained by the U.S. government, claims on the website last updated in March of 2017 that naloxone is safe and used by emergency medical personnel and first responders to reverse opioid overdose. Opioid abuse is still rising, from the false advertisement to the overprescribing. We can do our part to help decrease these risks at home and on the streets. We can also save someone's life by identifying the signs and administering the life-saving medication naloxone. So at your next dentist appointment, when you're prescribed an opioid, know that this drug is addictive and could cause you or others harm if not stored or taken properly.